happens when you first think of how the government delivers public services. Let's just think of what happens when we think of what is the government doing for us. Think of images. What we think of is broken roads. We all travel by them. We think of the potholes. Like our wonderful MC said, we look at the rasta and say, "Wahan pe gadha kyun hai?" We think of our public education system. I mean, how many of us really would consider sending our children to a public school because we think that they're devoid of teachers and desks and benches? We think of public hospitals, and unless we really need to, most of us don't go there because we think it's overcrowded, and the fact that there aren't beds, there aren't nurses, there aren't doctors. And if we think of our sanitation system, we just think of a pile of crap. I mean, that's what comes to mind. So to none of us in this room is it surprising that we're not exactly content with what the government is doing in terms of public services. So the question is, what's the problem? I mean, where is the issue? What is essentially stopping the government from doing this? And most of us, our first thought that we come up with is that we're a poor country. We do not have enough money or resources to be able to build good roads, to be able to build good infrastructure, hospitals, schools. But the fact is that that's not entirely true. The fact is that we're not a poor country. If you just look at the central government budget, and the central government budget is often matched with the state government budget in terms of programs and welfare schemes. You'll see any program run into thousands of crores. Just look at our health mission, our national health mission, which is divided into urban and rural mission. And what you'll notice is there's a lot of money that exists in the system. The second thought which we have is that potentially there's corruption, there are leakages. So what if there is money? They clearly are going in the wrong hands, and perhaps that's one of the big issues. And there is some truth to that. There is, in fact, some amount of leakages which happens. But that's not the only issue which comes up. So essentially, if we look at what is going on, in 2012, we started on this journey. We wanted to see what is going on at the ground level, what is happening, why is public service not being delivered? And we reached out to a member of parliament, an MP from Barakpur. And our thinking was that, look, MPs are usually the first person that the electorate goes to or the citizen goes to say there's this issue. And so the MP from Barakpur essentially told us that in jute mills, which is a major part of his constituency, the workers were suffering major health concerns, such major health concerns that it was frightening for him every time he went back to the constituency and had a discussion with them. So obviously we were curious, and a team of us went into the ground to see what was happening. Now the jute mill essentially employed anywhere between 30 to 50,000 people in that community. And when you walked into the jute mill, if you think that pollution in Delhi is bad, this was about 10 times worse. You could see matter in the air, what you were breathing in. And essentially, you could see it was very obvious why people were suffering from respiratory diseases. So we did a little poll. We tried to understand what's going on, really. And what we noticed was about 90% of all workers in the jute mill were either at high risk of a respiratory disease or already had one. We moved on to figuring out the solution. Clearly, there's a problem. We know that. It's affecting a lot of people. The MP is clearly wanting to bring in a solution. What do we do? What we noticed was that there is someone called a jute mill commissioner who's there at a state level. Now, this is a very minor fact which most of us would not know. But the fact is that the jute mill commissioner in this case essentially sits on a pot of fund which is responsible for the welfare of the workers, of the factory workers. We went ahead and we held health camps. We went ahead and we did street theater. We went ahead and tried to create awareness around the fact that it was unsafe to be in the factory ground without a mask. If you're essentially breathing in that air, that's not good for you. As we're doing this, we realize that there is something else which exists. There is a national government scheme which essentially enrolls workers so that you can get insurance and be treated in a public or a private hospital. So one of the big initiatives which we had was enrolling all of these 30,000 workers in one of the factories into the programs. Now that alone was transformational because now you had workers, most of whom did not even know that such a program existed, come in and work in the system. What this essentially points out in terms of our framework is that there are some gaps which exist, and specifically there are 3 gaps which exist. The first is that oftentimes there is a knowledge deficit. A bureaucrat, a jute mill commissioner sitting in some faraway district in West Bengal might not necessarily know what is going on. They might not necessarily know how many people are enrolled and what the ground realities are. And essentially, there is a need to connect those 2 points. There is a knowledge gap which exists. There is a gap which exists on understanding. There are some 74 schemes that exist to support the poor. And what we're trying to do essentially is create that awareness and that knowledge about what are the different pieces which are there. The second piece which exists is, I understand what the problem is, but again, that mentality of we're a poor country, we don't have enough money. What are the resources? Where's the money going to be pulled out of? Being able to create that segue and to say this is where resources can be pulled out of, and pointing out specifically where the money resources lie is a big piece which we're working on solving. And the third piece which we're working on is actually having people on the ground. Currently, we have the bureaucrats we have who are at an executing capacity is 1/5 of that of, let's say, compared to the United States. We are very understaffed on the ground. Our decision makers are very few, and our work is huge, especially considering each district gets allocated significant amount of resources. And yet there's so much work to do that all we do is disperse money, hoping that it will get done. So then we started thinking about that this is good and fine. So we have people who go into the ground, who connect the right hand to the left hand, who figure out that there is a gap, a problem, come up with a solution, and mobilize resources. This is understandable. There is a gap which is fulfilled. But what do you do in the longer term? Essentially, how do you figure out that in the longer term, we need to have the back-end system within the government administration to be able to sustain these models of understanding what is happening on the ground and create corrective measures. So we tried something new in Balasore, which is a district in Odisha. Essentially in Balasore, what we said was, what if we had a back-end dashboard? What if we had a real-time platform for district officials where I could, as a district official, see at a household level that these are the schemes and programs that this family has access to. And this is where the resources are coming in from, and are they matching? So for example, there is a yojana which essentially allows for people to build houses. This is very big in Odisha. The assumption that a district magistrate would have is that so much money is coming in. Clearly, there are going to be a lot of people who are accessing the scheme. But I don't necessarily know if that's true. What we did was we essentially went ahead and at a household level went and asked the question, how many people have access to the scheme? And went ahead and then provided a real-time geotag platform to say, okay, these are the number of houses who do have them, and this is who doesn't have them. And by the way, this is how much money you have available. So what we did was we tried to connect the whole platform. Right now, we have a team of people who are working there, and it's the little things, right? It's the going ahead and realizing that there's a healthcare center that needs to be redone and rebuilding it. It's going ahead and holding information session with farmers groups and saying that this is how you can get money out of the system, and this is what you need to do. It's connecting the dots. So what does that mean for us? What does it really telling us? What is the main takeaway today? The fact of the matter is that we think that our government is too big. Our bureaucracy is too bloated, and the fact that we don't have enough systems or enough money. In fact, the opposite is true in each case. The fact is that our bureaucracy is too lean. We don't have enough government support that needs to be created. The fact is that we have enough money to be able to create ground-level impact. What we need is you. What we need is smart, engaged citizens to be involved in the process of governance and nation building. So as we're celebrating you, think more actively about how you can be a part of this nation building process, because we really need you in governance. Thank you.